Hello everyone, welcome to Pathomad. Today our topic is about Rosai-Dorfman disease. In this disease, there's massive proliferation of histiocytes. Histiocytes, as the name suggests, it is a tissue macrophage. Histio means tissue, site is a cell, so there's massive proliferation of tissue macrophages, most commonly occurring in lymph nodes. Whenever lymph node is involved, lymph node has sinuses. Hence, this disease in lymph nodes is also given a name of sinus histiocytosis with massive lymph adenopathy. Sinus histiocytosis with massive lymphadenopathy. This name is synonymous with Rosai-Dorfman disease of the lymph nodes. So, whenever it involves a cervical lymph node, the patient presents with massive and it is a painless cervical lymphadenopathy. As you can see in this clinical image, this massive cervical lymph node enlargement, massive cervical lymph node enlargement, and it is a benign self-limiting disorder, and the cause being unknown. Mostly, the causes are unknown. There can be two possibilities of a viral infection that can lead to defective immune regulation. Two possibilities of viral and also immune defects. And certain studies have shown mutations in MAP2K1 and ERK pathways. MAP2K1 is mitogen activated protein kinase. This is one pathway. Other pathway is the extracellular signal regulated regulated kinase regulated kinase pathway. These two pathway mutations have been observed in patients with Rosai-Dorfman disease. This is the brief introduction regarding the Rosai-Dorfman disease, which is a benign, massive histiocytic proliferative disorder most commonly seen in lymph nodes, which presents as a massive painless cervical lymphadenopathy. The most common site being the lymph node. First most common site is the lymph node, which is given the name nodal Rosai-Dorfman disease. More than 50% of cases are of nodal variety. There are few extranodal sites also, that is apart from the lymph nodes, something away from the other than lymph nodes. The most common extranodal site being the skin involvement, cutaneous Rosai-Dorfman disease is the most common extranodal site. Other rare sites being the bone, orbits, CNS, and PNS. That is paranasal sinuses. The bone involvement, osseous Rosai-Dorfman disease is a is a certain uncommon. Other areas being the orbits, the paranasal sinus. All these paranasal sinuses also involvement of CNS. The brain involvement is extremely rare. Most common the location being the lymph nodes first. First the lymph nodes, next the extranodal site being the cutaneous. Coming to the histopathology, if at all, because lymph node is the most common site involved, lymph node has this sinuses. As we have studied in my earlier lecture about Castleman disease, I have explained about the structure of a lymph node. Lymph node, this is the capsule of a lymph node. These are the trabeculae. Beneath the capsule, there's this sinuses. These sinuses run subcapsular sinus, trabecular sinus, medullary sinus, merging and exiting as the efferent lymphatic. So these sinuses they become dilated. These are dilated and they are filled up with this histiocytes. These are dilated, filled, the tight packed with histiocytes. And the most distinct feature of this Rosai-Dorfman disease is the emperipolesis. The histiocytes show emperipolesis. Emperipolesis is nothing but eating another cell or engulf. They engulf other cell. The histiocytes they engulf most commonly lymphocytes, or else they can also engulf plasma cells and RBCs in cases of extranodal RDD. So, for example, you take this is histiocyte or the macrophage, tissue macrophage or the histiocyte. This is the tissue macrophage or the histiocyte. This is the nucleus of it. So these are the lymphocytes. This has eaten away. This has eaten the lymphocytes and also plasma cells. The plasma cells have eccentrically placed nucleus, whereas the lymphocyte has a centrally placed, fully occupying nucleus. And also fibrosis is more marked in extranodal sites. So this is the histopath image showing you the histiocytes. All these are the histiocytes. The histiocytes also show a feature of syncytial pattern like the cell wall. The cell wall is indistinct, so you don't know where the cell begins, where it ends. So it gives you an appearance of sensation. Sensation is because you don't define, you cannot define the cell borders. The cells appear to be merging with their adjacent cells, giving you a multinucleate appearance. This is one histiocyte. This can be other histiocyte, but cannot distinguish the border. And there is a nucleus which is vesicular nucleus. Vesicular chromatin means in some areas there's paleness, in some areas the chromatin is condensed. This alternating pattern of this pale chromatin and condensed chromatin, pale and condensed, like salt and pepper, that is a vesicular nucleus. Also, it may show, for example, it may show centrally placed nucleolus also. Here, centrally placed nucleolus also. And here in this slide, this massive lymphocytic infiltrate. All these are the lymphocytes, lymphocytic infiltrate. This is other histiocyte showing you engulfed lymphocytes within it. This histiocyte has eaten many lymphocytes. This phenomenon is emperipolesis. Emperipolesis, which is a distinct feature of Rosai-Dorfman disease. Another histiocyte showing you all the engulfed lymphocytes, all the engulfed lymphocytes, all the engulfed lymphocytes. See this is other histiocyte. The cell borders are indistinct. This is the nucleus. We are showing you vesicular chromatin. The cytoplasm is abundant. It can be a pale. It can range from pale to eosinophilic cytoplasm. This is the other image of Rosai-Dorfman disease showing you this fibrosis. It can be, it must be a extranodal Rosai-Dorfman disease showing you massive fibrosis, also dense lymphocytic proliferate, and here and there in this is one histiocyte. This is the nucleus of the histiocyte. It shows you eaten away, that is the engulfed lymphocytes. Engulfed. This is other histiocyte with a nucleus and this lymphocyte engulfed within other histiocyte. These are the histiocytes with indistinct borders. This is the nucleus, engulfed lymphocytes. Yeah, cell borders are indistinct for this histiocytes. So coming to the immunohistochemistry, IHC, the Rosai-Dorfman disease show positivity for S100, is the most common marker. Also for CD 68, 163, OCT2, cyclin D1. This image shows you S100 positivity, that is the cytoplasm. Cytoplasm stained brown, cytoplasmic positivity, and this S100 it negatively stains out, it negatively outlines the engulfed lymphocytes. These are the lymphocytes that are not stained by the S100. Only the histiocyte is stained. So even in IHC, you can clearly see the emperipolesis. Emperipolesis. So emperipolesis is very a star mark or a distinguishing character of this Rosai-Dorfman disease. Thank you all.